Okay, welcome back to the next installment of the video lecture series. Over kind of what we've already covered in class. I don't think there'll be any new information, but stuff for you guys to review. If you get caught up or confused or something like that, you'll have this to kind of maybe refer to. So let's talk about it. The respiratory system, that's kind of where we were at today. And the function of the respiratory system is to provide the body with oxygen. And we kind of covered that today. We talked about the oxygen, right? And we talked about the body's need for the cells and to receive oxygen, but also the important factor of removing CO2 from the cell as well. So that's all important functions of the respiratory system. And then we introduced the alveoli, the capillaries, the worm bed. Remember that? And we talked about how that worked as well with the alveoli, receiving the O2 from the outside when we breathe it in and storing that. And then we talked about the body's ability to, at that capillary level, drop off the dirty CO2 blood received by the alveoli, and then the O2 would go from the alveoli into the blood cell. And we had even mentioned diffusion and that process as well. So here we go. We have a picture here of a bronchiole with the alveolar sac. And we talked about once the blood came in through the right ventricle. Sorry, wow, don't listen to that, right? When the blood enters in the right atrium and it goes through the tricuspid valve into the right ventricle, through the pulmonic valve and out through the pulmonary arteries. And so here we have that picture right here. Here's a pulmonary artery, and yes, it is called a pulmonary arteriole. It just changes names when it becomes smaller, but as you can see, it comes through here. I'm having a little problem here. Stand by one. I hope it doesn't crash. Okay, maybe it won't crash. Comes through here, and here we are at the alveoli. This is where the gas exchange takes place. And then once the gas exchange takes place, meaning that the CO2 has been dropped off here in the alveoli and receives the rich oxygenated blood, it's going to come back, and this time it's coming back through the pulmonary artery. Oh, I'm sorry, pulmonary vein. And here we go, we're traveling through, and from the pulmonary vein, of course, back to the left atrium. Some other points of reference we had talked, maybe you can see it better, on the computer here, but here's that yellow, that's smooth muscle. Okay, that smooth muscle keeps that bronchiole at the right opening. So if it constricts, then we know it gets smaller. That's where your asthmatics come in. And so that's what the smooth muscle does there. I don't see really. I think we can go to the next slide. So we talked about oxygenation, and what we talked about there is the oxygen molecules moving across that membrane from an area of higher concentration to the area of lower concentration. So if we go back and look, we can see that that's going to take place right here. We have CO2 represented here. It's going to go from an area of higher concentration, meaning right here, inside the alveoli, because at that time it will have a lower concentration. The CO2 is going to go in here, right? And it's going to pick up the oxygen at that time, which will be moving from here from a higher concentration back into the pulmonary artery, because there is extremely low concentration at that point in time of O2, and then picked up and carried by the pulmonary vein. That is oxygenation. And then we talked about cells, and so cells are oxygenated when oxygen moves out of the blood, and that is correct. And then the oxygen then can be used for to be metabolized, and that's what happens. We'll explain that kind of later time. All right, so the sequence of events here are very important. I've said that 100 times. There's only 1, 2, 3, 5 things, so it shouldn't be that hard to remember. Air comes in the mouth, okay, and it travels from the mouth into the back, and we call the back of the throat the pharynx. We mentioned the nasal pharynx here. The nasopharynx, meaning it's that part where part of your throat where air comes in through your nasal cavity and comes down the back. This is a little bit further down. It's called the oral pharynx, but nonetheless, guys, pharynx, throat, okay, same thing, right? And then we go from the pharynx to the trachea, okay, windpipe, and then from there down into the bronchioles, and then the bronchioles extend down to the alveoli at the very bottom. That's what this represents right here. All right, from a top view down, we had mentioned this in class. Let's just go over it again real quick. We have let's look at the anatomy again real quick. Right here we have the right atrium, right ventricle, the left atrium, the left ventricle. Right here is the pulmonary artery. Underneath, the pulmonary vein. Right here are your bronchioles that stretch down to the alveoli. Alveoli are not shown in this. I think the whole purpose of this is so you can look down and see that the pulmonary artery and vein are located, they come together down here in the alveoli to make a gas exchange. And we'll continue. We talked about oxygenation. Again, a side-by-side picture. See, on this side you can see the pulmonary artery and the pulmonary vein. Here is your pulmonary artery here, and your pulmonary vein here. These, again, is your bronchiole. It's just a side-by-side version there so you can see how the two connect. We introduced ventilation, and ventilation, the mechanical process by which air is moved into and out of the lungs. Ventilation is not respiration. Ventilation means it's mechanical. If we decided to provide positive pressure ventilation through a back valve mask, and we'll introduce all that later, but we're doing that, and that's mechanical. A ventilator is mechanical. I mentioned the rib cage, rib fractures. If your ribs are fractured and you won't take a deep breath in, that's a mechanical problem. Okay, so now we're going to kind of define the upper and lower airway, and we define that using the landmark of the larynx, and the larynx is right here. Anything below the larynx is considered the lower airway, and anything above the larynx is considered the upper airway. If you have an upper airway occlusion, okay, and it occludes right here, you won't get air down to the lungs. Okay, that's a total airway occlusion, and it's possible to have a lower or an upper airway occlusion. Anytime this, oh, I'm so sorry, back up. Anytime this is blocked, okay, anytime that's completely blocked, there is no air getting down. We won't get a gas exchange, and it's life-threatening. We now go to the epiglottis, and we talk about it in terms of its structure being leaf shape, and its function is to protect the larynx and the lower airway from food and liquids. That is its function. We're going to get a better picture of it here. This again is your larynx here, and we have the epiglottis here. It's that leaf-like structure that helps keep food away from the larynx and in its proper place, the esophagus. Got another picture, and here we have an epiglottis right here, and you can really see the leaf-like shape here. And we talk about the epiglottis actually can become an airway obstruction if it swells and or becomes inflamed. And if it does, we can add itis to the end of it, and it becomes epiglottitis. The trachea, we talk about it branching into two bronchi, and here you have a representation of that. Here's the trachea branching into the left and to the right bronchi. It further subdivides into smaller sections called bronchioles. And we talked already about that smooth muscle that's there that can cause, that can constrict and actually restrict airflow. We see that with your asthma and your allergic reactions. Okay, just a brief look now at the alveoli that are down here. They're at the end of the bronchioles. There's your alveolar sacs, or your alveolus. And we talk about the airway here, the alveoli, the tiny air sacs. And there they are. We talk about now if you have something that occludes them or covers them, like pneumonia, liquid, any inflammation there that covers those sacs, that will affect gas exchange. And then we have air, we talk about ventilation itself, right? And we talk about in ventilation the mechanical process of the diaphragm. And it is a mechanical process, and we talk about those mechanics. Here you have the xiphoid process. Here you have your diaphragm. When the diaphragm contracts and pulls down, the lungs, the rib cage expands and allows the lungs to expand. There is muscles in between the rib cage. They're called intercostal muscles that assist in this process. And then when the diaphragm actually relaxes and moves back up, it allows the rib cage and chest to relax and the lungs to relax, and allowing you to breathe out, and that is expiration. Here's a representation of those intercostal muscles here. We have external intercostal muscles, internal intercostal muscles. Just need to know that these muscles increase the size of the thoracic cavity, and they allow air to move into the lungs. The phrenic nerve, we will talk about that a little more, probably in class, but the phrenic nerve is actually the nerve that sends information now to the diaphragm and tells it to contract. The airway comparisons here, you can probably see it better on this. On this slide. We have the child has a smaller nose in comparison to an adult. The child's more space is taken up by the tongue. The tongue is proportionally larger in a child and takes up more space in that airway. The cricoid cartilage, and I will show you that, is less rigid and more developed. The child's trachea is more narrow, and which leads to more upper airway obstructions in children. Adequate versus inadequate. So we're going to talk more about this in chapter 8, but it's important to understand. We look at a couple different things to determine this. One, the rate, the number of times per minute that a person breathes. Okay, and then we look at the volume. The volume is the amount of air that is inhaled with each breath. And so together we look at rate and volume. Now I can have a low rate and still have plenty of volume. So they're not we can't take just the rate into consideration. It's the rate plus the volume. I can have a good rate and bad volume and have inadequate breathing. So signs of inadequate breathing, these are signs. It doesn't mean that it's going on. It just means that they're signs, because an abnormal rate by itself is not enough. I need a bad rate. An irregular pattern would lead me to believe that there's poor volume. A decrease or absent in breath sounds, that would indicate that I could have obstructed volume. Unequal or inadequate chest expansion, again, that tells me that I'm not providing enough volume. Poor skin color could lead me to question the rate and the volume. Use of accessory muscles could lead me to question the volume. Nasal flaring, most prominently in children, you'll see their nasal passages moving in and out. Agonal respirations. Now, the definition of that, it means deep, irregular, and gasping respirations. These are usually people that are fixing to die that have this type of respiratory pattern. And grunting. Grunting is making noise, and what that process actually does is it tries to keep the lungs open just a little bit longer in order to allow for gas exchange. Okay, I'm going to stop right there. I don't want to go too long with these videos. That was the respiratory system, and we will add the next video about the circulatory system in just a little while. Hope you have a good day, and we will see you guys on the next one.